Hello, I'm Craig Constantine. Welcome to Pod Talk, short conversations with indie podcasters that are not just about podcasting, because I like to take the scenic route. My guest today is Dr. Howard Gluss. Welcome, Howard. How are you this afternoon?
I'm doing great, Greg. Thanks for having me on. I appreciate it.
Oh, I appreciate it myself. This is like off the charts. The part before we pressed record was really good. I think the place that we should start, as we said, is to talk about the balance. So I'm going to call you an actual practitioner. So you directly see patients and work with them.
Right. I'm a clinical psychologist.
Right. And you're also a podcaster. So
Yes,
I'm
exactly.
So
I have
yeah.
two lives going on, entertainment and psychology.
So your podcast talks to experts on various topics, and we, I'll let you dive in there about what your show's about. But the question that came to mind was, how do you rationalize? You have to balance your time between these two things. You can either directly see people and directly help them, one-on-one basically, or you can work on the podcast, which probably has a bigger ripple effect, but you're not trying to directly help a person. So what are your thoughts on how you balance your time between those two lives?
Well, I don't think of them as mutually exclusive. I think of them as interconnected. So for instance, when I'm seeing patients, my focus...
And you don't have to lean into that so close. You can just relax. Because
when I see patients... Sorry. When I see patients, a lot of times my sense is I'm there to really be present for them. And it's not about me, and it's not about my self-expression. It's about being of service to the patient and trying to help them as much as possible. When I'm on podcasts, I feel, here's my opportunity to actually express myself and make it about me, make it about Howard. So I try to balance the two. And we know it's impossible to ever have a perfect balance, but it seems like one feeds the other. So if I'm happy podcasting and it gives me a sense of creativity and self-expression, I'm going to feel more present in my sessions with clients or patients. So that's how I try to balance the two. The focus is different.
That's brilliant. Do you ever find yourself...
I didn't say it too close to the mic.
I really hate to interject and be like, back up, but you were great. And then you got excited. You're blowing my doors off. I'm wondering...
Well, what it reminded me very quickly is, so for a few years, I did a show on KBC radio. And on the radio, I had to keep my...
Oh, yeah. It's an SM7B.
You have to be like right on top of the mic.
Right up against the grill.
Yeah, exactly.
Because it gets the condenser mic. Fortunately, listeners are podcasters, so they love that stuff too. We could talk about that for 20 minutes.
Right.
So we didn't mention that in your clinical practice that you work with people, or grammar, Craig, you work with addiction. That's your specialization, your specialty, helping people with addiction. So tell me a little bit about maybe the kinds of, I'm going to say maybe the sorts of breakthroughs that you see people making. So like your definition of success is when somebody is able to overcome an addiction or understand their addiction. I'm throwing questions in your mouth.
Yeah, I think that, first of all, being sober is usually the success of overcoming an addiction. Right. So that's very important to be able to do, because you can't be in two worlds at the same time. You can't be actively in an addiction, whether it's a behavioral addiction like gambling or sex, and not be in an addiction, if that makes sense, or if it's drugs or alcohol. So on some level, you have to decide what world you want to be in, because you can't do both. And I always say to clients or patients, you don't see a lot of people when they win these big awards saying, I want to thank my drug dealer for getting me to this place. And if you get to live long enough, you can't just keep abusing yourself that much.
Right.
So to me, success, addiction is very compulsive. And that's why it's called an addiction. And if you're out of addiction, if you're out of disease, when I try to treat people, I like to look at two aspects of them. I like to look at them as a person, and then I like to look at their addiction. The addiction to me is the disease part, and the person is the person I'm trying to get a handle on, because that person gets lost in the addiction. So once you can normalize someone, in other words, if they've had a detox or they've been sober for a while, if you can get that same person to start just working on their stuff, start discovering aspects of themselves that are separate from the addiction, things they feel passionate about in their life, chances are that eventually, this is the hope, I'm crossing my fingers, this is the hope, that eventually they're going to create a life that they actually like. Doesn't mean it's going to be easy, but they're going to like it, and they may not want to destroy it with addiction. So, as a cliche, I would say, if you're living a life that you really like and you feel passionate about it and you can handle all the stresses of it and have the support system around you that you need to keep it going, whether it's a good therapist, friends, whatever it is, AA group, I think then you've created a lot of distance from your addiction. And that's always going to be part of who you are, that addictive personality. But you can, it's like turning the powers of evil to good. You can use that obsession and channel it in something very positive for yourself.
When we were talking before I started recording, I asked you, just because I like sometimes I just grab two random things and smash them together. And I grabbed podcasting, like as a creator of podcasts, podcasting. I didn't think that it felt like it was particularly hazardous. Like my understanding of certain hard drugs is like, you don't want to mess around with that because that's pretty physically addicting, pretty darn quick. So podcasting to me doesn't feel like it's dangerous in that sense of addiction. But then when I started to think more about some of my behaviors around obsessing over perfection, about how every episode has to have a really great summary and a really great, I'm like all these, I always say deck chairs that I can rearrange while the Titanic is sinking, or all these railings I can polish. And then I began to think, oh, maybe podcasting really can be addictive. And I'm just wondering if you point your inquisitiveness about addiction and look at the way that you podcast, are there things about it that you've chosen? Okay, I'm going to stay away from that because I feel like that could be a road to obsessing and possibly becoming addicted.
Well, I think you just gave us the answer. If I stay away from the road of having it perfect. Or, even for a few years, I did a radio show here in Los Angeles on KABC. And I remember and I've done radio on and off for about 7 years as a psychologist. And I remember, every time, and I do this every time when I start getting back into radio, I'll plan out the whole, I'll take notes and plan it all segment, out, right? Do all that stuff like that. And then it goes to notes that are almost scripted, to talking points, to, hey, what's your name? Let's just riff on the subject because I'll gain the confidence. But I think the more you can stay away from that obsession and get some free will and just relax into the process, not worry about being perfect, I think the better off you're going to be.
I would agree, but I'm not nearly I'm not credentialed.
Oh, yeah,
I would agree. That's what works for me. Stay away from the parts.
That's a great point. Like you said, it's an ideal. It doesn't mean we're not constantly working at it.
Yeah. Yeah. I looked at your, when I looked at your show, Engaging Minds. So is it Engaging Minds with Dr. G or Dr. G?
It's Dr. G Engaging Minds.
Engaging Minds. When I looked at it, the first thing I do is I go like, how many episodes does this person have? I'm like, okay, you've done over 100 episodes. So you're beyond the, what am I doing flailing phase. And you've gotten to the point where, from what I heard, you're no longer hypersensitive to, does this guest exactly fit the giant painting that I'm trying to make? And you're more, this is interesting. I'm going to go down this rabbit hole with this particular expert. So I'm just wondering, does your work in podcasting get meta about podcasting, like in your own head? Or do you feel like I'm podcasting about, I don't know if psychoanalyst is the right word to use, but like, do you feel like podcasting for you is about your psychology work? Or do you feel like podcasting turns into like this self-referential, I'm using my podcast to work on and talk about podcasting? Does that make sense?
No, I think for me, my podcasting work is about my psychology work. It's just an extension of who I am. It's just a different arena I'm playing in. So I may play it in the office, as we talked about earlier on clinically. I take that same experience. I try to bring it to the, to the podcast. And I know my lane, so I'm
Mm,
always looking at the psychology. So a lot of times I don't really care what the subject is. People will say, "Well," I said, because my goal is to try to find the psychodynamics that are present in that subject. So I try to go on a journey with my guests and look for those aha moments where we're both going, "Wow, that's really interesting."
yeah, no ultimate
Wow, I
destination, right?
learned something on that. If I don't learn something on the podcast, then I feel it wasn't successful. I want to start the podcast and be in a different place by the end of it and go,
Mm.
okay, I actually got some interesting insights for myself. And that feels satisfying.
Yeah, I would agree wholeheartedly. That's the power that,
That's the excitement of it.
yeah, I think
That's
so.
the creativity, the excitement.
Let's turn completely left because I totally want to get to the audio topic. You know where I'm going. This
I
has
know where
nothing to
you're
do with what
going.
we've been talking about, but we started talking about. I've often said, but many people say this too, that audio, the medium of audio without video, just straight audio, that there's magic in that audio. And yeah, on one hand, we are as podcasters literally in people's ears. But I also believe, because my understanding of biology is the parts of our brain that are involved in audio are much older brain structures, that they are often still working, even if you are asleep or unconscious. So I think that maybe hints for me, that hints at audio is really special in like a privileged sense. And so my question was, when we were talking before, was, does that possibly mean that it could be particularly addictive? Like, I don't think I'm addicted to listening to podcasts. People who know me well
Right.
might
Yeah, we have to
disagree.
be careful not to apologize too much.
Right.
Yeah.
But I'm just wondering what your thoughts are about that
This
particular
medium?
sense. Yeah, like I can be addicted to food for real because of taste and because of the gut brain interaction. But audio has a completely different set of different sense organs.
Yeah, I don't know. I'm not that clear on the hard science of it, so I don't feel comfortable commenting on that.
Mhm.
But I do feel from a psychological and spiritual point of view that sound is very powerful. If you look at some of the Eastern religions, the sound of both in
Mm.
Buddhism, Hinduism, is
Sound
so
making, right?
prevalent, as a meditation. And I've practiced meditation for 25 years. And as you can see, it hasn't worked. No, I'm just joking.
I think I do it too, but meditation is a small rudder and I'm a big ship, but it's
Yeah,
important to
but you
steer
know what?
around the iceberg, right?
Yeah, but you know what? It keeps me grounded. A lot of times before I see a client, especially on Zoom, I'll take a minute and just center myself, and I'll use the sound of So to me, sound is very ancient. It's very powerful. It's very visceral, spiritual. It gets me very connected. That's what I find that's interesting about podcasting is it's all audio.
Hmm.
So it takes me on a certain journey, I think, that is different than maybe watching a television show where it depended more on visual.
Hmm.
Because that shut down, all I got to do is listen. I often think how different people may have been wired when they were listening to radio as a form of entertainment
Hmm.
than
I hadn't thought
being
about
on our
that.
phones and doing TikTok every 3 seconds and moving, and how much. And I know there is a lot of research out there how much social media and things like TikTok are affecting our brain and our
Yeah.
attention span, etc.
Yeah. There were so many things there, but that's a good point about, I hadn't really thought about the historical, uh, to this, I don't want to say the milieu, the social
Right.
surroundings of the radio, as the thing in the middle of the living room, um, where it only was audio. And I have listened to War of the Worlds. Is that George? Is that Orwell? Orson Welles? Phew, brain not
Well,
working.
I'll share something with you. One of the things, which is a podcast, a different podcast that I'm involved in that I actually produced, was one called Intimate Fame. And it is solo one person shows written by Scott Edward Smith that are like old radio dramas.
Hmm.
And they're audio, we call them audio dramas. And one of the things I was very attracted to was the sense that it felt like was very intimate. Like it felt like I had to listen to these episodes, and they're one person shows. So right now we have one on Wallace Simpson and one on Marilyn Monroe, and we're about to launch one on James Dean. But the reason it makes it so intimate is because it's all focused on these characters talking about their lives from their perspective in a very intimate way. So it's all audio. So it's an interesting way of presenting their stories.
I find that kind of material really engaging. And I think it's also the same reason why I enjoy reading so much, because I think it was Carl Sagan said that humans can work magic because we can take this stuff pressed on a piece of a dead tree, and then hundreds of years later, you read it, and my idea is now in your head. That's magic. That the fact that when you're reading, there's a lot of information there, but you have to fill in basically all of it has to be filled in around that. All the imagery and the sounds and everything gets added. And I think audio works the same way. At least I am such a visual person. If I read it or hear it with no visual input, my brain just goes, yeah, well, of course there's a visual part. So what would that be like?
Don't you find that you have a different experience if you're just listening to something than if you're watching something?
I think so. I mean, the visual change, there's so much more information that has to be in the visual. So, there's a reason that it isn't just a screen of snow on the average YouTube video. There's visual information too. I mean, there are certainly situations where, yes, put the graph up, because it's easier to, that's worth 1,000 words. But even then I've read things where I'm like, that could have been a really simple photograph, but the storytelling involved in painting that picture metaphorically really is interesting.
It'd be so interesting. I mean, you made me think as a psychologist. I thought, well, that would be such an interesting research project to see if you presented the same material, almost the same visually and
auditorially,
auditory, and see what kind of, if it had a different effect on people's psychology.
Oh, it would have to. It would have to. There's a lesson, like a side lesson that was done in the podcasting course that I was part of, where we had a student did this and it became a thing we just played for everybody. And one of the students took the exact same audio track. So it was him reading a piece of a novel, just like the opening paragraph of a novel, but it was laid on several different music beds. And they are so different. It's like there's an electronic sound mix. There's like a mystery sound, and like completely different. It changes the tone, what you're imagining. Like he's describing a woman on a platform. And then you realize that it isn't just the same words. It's literally the same audio. And the one that's got the techno music, you feel like he's reading at a faster, more punchy pace. And it's exactly the same audio of the voice. So there's so much information in that audio. Sometimes I feel like, why do we need anything more?
No, it's a very good point. A lot of times I think about it. People don't, like as a psychologist, again, don't realize they're so focused on the content, but they don't realize all the other things that might come into play. Like you said, the music, etc., and how that can affect someone psychologically. Even, a lot of our work as psychologists have now moved to telehealth. It hasn't really stopped since COVID has somewhat subsided, because it's still there, but it's different. It's a different beast right now. I still have most of my clients are doing it through telehealth. They don't want to come into the office. One, they don't really want to drive, and they've gotten so used to this medium of Zooming,
convenience,
that there's a whole interesting study too about why. And it's a different experience of clients and patients than when they're physically in the room.
Yeah, I would have to imagine, having only ever been a patient of that type of psychoanalysis virtually, I would have to imagine that if you go to the physical office, it's going to be much more of a controlled environment, because like like as the person in the chair, or the the person driving, the therapist,
right?
Come on, Craig, as the therapist, if you look through the Zoom and you're like, well, there's half your problems right there.
Right. Or you have to tell a client, can you put your phone down? Can we focus? But
I'm wondering, maybe
especially
that actually
people.
is helpful, because you can see, like, if I come to your office, I could really I mean, I don't know, I could be a different person, but you don't get to see me in my normal. It's like going to the animal in the zoo. You're like, oh yeah, I'm not doing so bad this week, doc. And then I leave
No.
and I go back to my normal chaos. So maybe in some ways having telepresence lets you really look in the actual fishbowl.
Yeah, I think each one of them has different sort of positive and pros and cons, if you want to put it
Mm.
that way, and different attributes. But they are definitely different animals.
Mm. What do
And
you?
as a therapist, it's a different experience.
Mm.
It's very different seeing someone on a Zoom meeting than it is seeing them in person.
What's maybe some of the differences?
Well, I know talking to other psychologists, we all talk about how really tiring it is to be focused on a screen all day.
Mm.
And you don't get all the body language that you might get otherwise. There's a lot that happens, even the way I know very subtly. You talked about music. For me, letting someone into my office and walking through the door and how they decide to come in will tell me a lot about them,
Mm-hmm.
who they are and what they focus on and what they might look at in my office. Oh, look at that painting or that. So there's certain subtleties I'm missing. I actually find it easier if I've seen someone for a while personally to then see them through telehealth because I already have a sense of who they are.
That's a good point.
But on the other side, telehealth gives you an opportunity to see people as a psychologist. It's interesting that that you may not have seen before. They live in different cities or whatever, and
yeah, your reach is much greater.
My reach
your
is
potential
much
reach. I'm wondering. So now, if we think about podcasting, let's
let's
jam
go back
that.
to
Go back
why
to
I'm here.
podcasting. Well, no, you can be here just to be about psychology, but as podcasters, now I'm wondering. Okay, so we're in this audio only medium. There is a whole discussion about video podcasts, but we're in an audio only medium, and it's one way. And if I'm trying to accomplish, whatever my show is, I'm trying to accomplish some goal. I'm trying to entertain, make somebody laugh. I'm trying to actually help them. I'm trying to share, facts, whatever it is. Now I have no feedback. And I'm just wondering I don't want to say, because I don't want to make everything be a disease, but what extra difficulties am I maybe facing as a podcaster that I don't realize because I have chosen to not have any feedback? You see what I'm saying?
My first thought is that probably the biggest obstacle is that we do this as human beings. We make assumptions about things. A lot of times with very little data or information. So we start second guessing. And if you're not getting enough feedback, you may start making a lot of assumptions that aren't necessarily true. So you want to be able to be very careful about that. And we'll base it many times on our own psychology. So if we are insecure about a certain thing, we might interpret everything from that insecurity into our assumptions. Oh, they didn't like the way I spoke. Oh, they, whatever it is, they don't like, I'm not smart enough. I'm not this enough. So not having that interaction, I think could be a really big danger. Because we always want to complete a thought, even if we can't, we'll make up stuff just to complete it.
Busted.
Are we allowed?
Busted.
Are we allowed using certain words?
Yeah, you can use any fucking words you want to use.
Well,
There's a
we
button
might
for
make
that.
up a bunch of shit just to make us feel complete because that eases our anxiety.
Yeah,
And then you go, that's not true,
yeah.
but it doesn't matter. I feel better.
I was thinking about the mirroring aspect in conversations or in good conversations. Part of what helps guide me, me could be anybody who's talking, but helps guide me is seeing how the other person's reacting. If I think I'm talking about something innocuous, but they're becoming triggered, I'm like, oh, I wasn't expecting
I'll
that. I
adjust
can
my communication.
dial that back. Right. That's a thing I hadn't really consciously thought before that. Yeah. When I'm podcasting, like I have no clue, like, are you and I right now triggering people? I don't think it's very likely, but it's possible we could have talked about somebody's addiction that's particularly shattering.
Sure.
So that's
but
great.
We are having an interaction. I mean, you and
Yeah.
I are having an interaction. So that's all we're really, and then the rest, who knows?
Hi, Mom.
I don't know how, we're trying to not do anything that's going to harm anyone.
Yeah.
But people can get triggered by walking into McDonald's and
Yeah, that's why it's called a trigger. Like it's
yeah,
a
you just don't know
trip.
what it is.
It's
You
not
can
an
walk in
obvious thing.
McDonald's and get triggered by ordering French fries. I'm not talking about my lunch.
The funny part of other people not knowing the things we all talked about.
Yeah.
We were discussing preferred foods. Mine is popcorn.
Yeah.
Is my
Yeah,
food of
mine are
choice.
definitely not McDonald's French fries, but I do like French fries.
No, I'm not anti French fries. I'm on team French fries too. But
Yeah.
all right. Well, Howard, it was a distinct pleasure to get a chance to, to chat. It's always fun, to like exchange a few emails, and I try not to let too much on about how I do this. And then we jump on, and it never ceases to amaze me how delightful it can be. So I appreciate your taking the time. Thank you so much.
I appreciate I'm going to do a little plug for myself. So
Definitely. Please do.
It's Dr. Howard Gluss, Gluss. I do have a company called Daranaut Health. And what we do is concierge type of in-home treatment for drugs and alcohol, but other situations too, like if someone's really depressed or anxious and has problems functioning. We basically do what you would do in the confines of a treatment center, but we bring all those services to someone's home. So if they're looking for discretion or a different kind of experience, some people have to work and they can't just stop their lives. So we tailor a program to people's individual needs.
And the other thing is that, can you spell it for me?
Yes. DARAKNOT Health.
Cool. So
that's it. And then the other part, as I told you about, when you asked me about in a whole different world is producing those radio type of audio dramas, one person solo shows, and it's called Intimate Fame. And you can just find the podcast that way.
Wherever I found it in many places, or wherever you normally listen. And your show,
good.
I do recommend.
It's getting around.
It's getting around. But I also recommend looking up Dr. G Engaging Minds is a
right. I forgot why I was here.
Well, it doesn't have to be why you're here, but that was the show that we talked about. And I think episode 4 of season 2 is the most recent one, was about the mind-body connection, which for people who know me would go, oh, well, Craig would be all over that. So cool. All right. Thanks again, Howard. Bye.
Craig, it was a pleasure. I appreciate the invitation.